The reason we're here tonight, the reason we're so excited is we really feel that we're at a tipping point in healthcare. If you think about the healthcare reform that was just passed in the U.S., it's kind of symptomatic of a larger change that's going to need to happen over time. And what we're talking about today is we potentially added between 18 and 35 million people in the U.S. to a healthcare system that was not expanded at all. So there's eventually going to become an access issue. You have the aging of America, where people are aging and they're going to demand a lot more health care over time. And as they look to demand more health care and there's a lot more people in the system, you can see where there's going to be a real crunch in terms of access. And when there's a problem with access, what we think will eventually happen is there's going to be more pressure on costs. And at 20% of GDP spending right now, or darn close to 20% GDP spending on healthcare, we're not sure that's sustainable over time. When we looked at this, and one of the reasons we're all here tonight is, are there solutions to this? Are there solutions from a business perspective? Are there solutions from a technology perspective? And we're lucky that we have benefactors like Gary and Mary who looked at this problem, and rather than just sit on the sideline and talk about it, were willing to commit their time and their resources to see if there isn't an alternate solution that we can come up with. And what we've been able to come up with, we're here to talk about today. All right, we really believe that we're going to be an institute that is rooted in business model transformation as well as technology transformation that we think has an opportunity to profoundly change healthcare, not only in this country, but all around the world. What is West Wireless Health Institute? Other than the place with the best address in all of San Diego, we are an independent, not-for-profit medical research organization. All right, we have one very simple mission, which is how do we use wireless technology to drive down costs? We think it's critical for us to create a healthcare system that everybody can afford. We have basically 5 functions, and if you haven't seen them, it means you just haven't walked in any of the rooms. And again, Gary, I want to thank you for the urging for consistency. So every room, just in case we forgot what it is. We think we're about innovation, which means we're going to talk about partners, and actually Eric Topol is going to announce several partners tonight, where we're working with established players in the industry and in other parts of the medical industry that we're looking to help transform them and their business models, as well as doing independent research, where there might be an opportunity that the market hasn't necessarily reacted to, where we think there may be an opportunity. And we will talk about a very generous gift from Gary and Mary tonight that will enable us to do even more in that space. We believe one of the challenges in wireless health is about validating outcomes and economics. So one of the functions that we think is absolutely core to the West Institute is basically how do we validate the outcomes from both a clinical and healthcare economic perspective. So validate, so innovate, validate, advocate. As much as we are very optimistic that our friends in Washington are going to create all the enlightened policies that all of us want from a reimbursement and from a regulatory perspective, there are some of us who believe there might be a benefit to engaging in a constructive dialogue with them. So we believe as a not-for-profit institute, we have a unique position because we're not representing an industry, we are not representing a trade group, that we believe that we have access, and that's been demonstrated in a number of ways from where we are today, and we'll talk a little bit more about the success we've had on the advocacy front and what we believe a role we can play in the future. We also believe that right now there's a real challenge in the investment front. If you look at total amount of investment in the medical device space between 2008 and 2009, it was down close to 35%. And every indication is between, in the first quarter 2010 to the first quarter 2009 comparison, we think it's down close to another 30%. So there's not a lot of money going into the space. Again, we think we have a unique opportunity at West Wireless to actually set up a venture fund and invest in promising technologies that will allow us to create the beacon or lighthouse projects that will demonstrate to a broader audience at both the policy level, the payer level, that this is really something that can make a transformational difference. And the last issue is commercialize. We are blessed, and we hopefully will have between 60 and 80 engineers in this building within a year. And we believe that they will play a significant role in developing, we think, very interesting solutions. Well, it doesn't do us any good if we develop the solution and nobody benefits from them. So we believe that we will need the capability to go right through the stage of commercialization, and we will have the capabilities to do that. So in the end, we're talking about innovate, validate, advocate, invest, and commercialize. So that's our 5 core functions. Our agenda, which we'll move to very quickly, I'm going to introduce Joe Smith, who is here to announce our first global partnership. I'd also, at this point, like to make a very special announcement that today we're announcing yet another grant from the Gary and Mary West Foundation of $25 million going to the Institute. And it's really important to talk about what this $25 million is for. Last month we announced a $20 million donation that will help us begin to build the engineering capability. Well, over the last 6 weeks since we were able to look at that, we have gotten a tremendous amount of momentum, both in the engineering area and in other areas. And when we were talking to the board, the sense is right now is a critical tipping point, and Gary and Mary are yet again stepping in to really add fuel to what we think is a very important mission. So this $25 million is going to put us in a position where we believe we will be able to go out and hire world-class engineering talent, and we will be starting that immediately to take our team and really expand it so we can make a pretty profound difference. So, you know, Gary, this is first, and Mary, the first about 6 times that we're going to thank you tonight. But on behalf of the Institute, we're excited that you see the promise in what we're doing, and you have the belief in what we're going to be able to accomplish, that you would make this kind of generous commitment. So again, thank you very, very much. You know, it's the beginning of a very busy month for us, and hopefully you'll get a sense of what we've been able to accomplish in the last year. It's going to be pretty interesting. Joe Smith will be testifying in front of Congress without a subpoena, without the benefit of a subpoena. Joe has been asked as a subject matter expert to come in and testify in front of the health committee of the VA about wondering how they can use wireless to help our veterans. And hopefully hopping in a car and immediately moving over, he is the lead speaker working with the FDA on June 24th. Talking about how you can foster innovation. So I think first it's a tribute to Joe, but it's also the idea that the Institute is gaining some notoriety in terms of our ability to thoughtfully think through policies. Tomorrow we're blessed with Anish Chopra, who is kind of the CTO. I mean, Christine would have a better explanation exactly, but he is in charge of health and IT at the Office of Science and Technology Policy. He's coming in for the better part of 4 hours tomorrow because he's looking at the Institute to deliver non-partial advice in some policy areas, as well as how do we begin to create an ecosystem that will allow for the dramatic acceleration of wireless health. We are so excited at this point. We'll be announcing 3 more strategic partnerships tonight, and we hope to be in the position to announce upwards of another 4 within the next 6 weeks. So we're working on that. And again, if Eric has been true to what we know, we might be announcing as many as 6 over the next. And we're not going to talk a whole heck of a lot about it, but I would like to thank all of the engineers in West Wireless because thanks to a lot of the partnerships we've been able to create, we will have our first product in the clinic probably within the next couple weeks. So we've gone from the idea that this is a spectacular enterprise to the point where we're beginning to actually develop products that we think will have an opportunity to make a pretty significant difference.